We have a very exciting session led by Axel Borsch-Supan at the Munich Center for the Economics of Aging, talking about data from SHARE on the effects of COVID and lockdown on EU citizens. Axel?
Thanks for having me. I'm really pleased to be here. I love conferences where I actually see people, so I really appreciate that we have about 50 people here in the room. I apologize for coming late and leaving early, very unpolite, but unfortunately these days are pension reform and long-term care reform days, obviously, around the European Union, so I'm shuttling back and forth. I really had loved to hear the assessment of averting, because, 20 years, 25 years, 30 years, I'm afraid. I was really part of, together with Estelle, doing things there, and I think they were successful, even if some countries, where's Agnieszka, did not follow. It's not your fault, I know. Did not follow the Holy Bible of the World Bank at that time. Anyway, I have a completely different topic today, which are the effects of the pandemic and the lockdown measures in Europe. So it's a very European-centric view of the world, and I apologize to all countries that are presented in this room, but I hope that we still have lessons here for all the countries. The aims I have today is tell you what the pandemic and the lockdown measures did to income, and particularly income inequality, what the labor market implications were, whether the remedial policies pushed, for example, by the OECD, whether they really were effective. If I have time, I also will talk about health and health inequalities created by the pandemic. I should say that all this is internationally comparative, but limited to the EU, as I said earlier. We use the SHARE data infrastructure, and I'll tell you a little bit what that is. And because I use that data, I want to thank the EU Commission for supporting the funding. It's a huge infrastructure, and the EU has generously supported it for now, 20 years. Okay, so these are the aims. This is the SHARE infrastructure. It's a data set in Europe, covers now all EU countries, plus Israel and Switzerland. And we now have 9 waves of data. Actually, the last time we talked, it was 8. And we have about 600,000 interviews by now, and almost 150,000 respondents aged 50 plus. So I'm concentrating on the population 50 plus. These are 3 generations, I call them. Workers between 50 and retirement age, then healthy retirees, I don't know until when, till 75 or 80 or so, and then the very old. This is 28 countries, and it's important to point out that we have life history. So that means we really know a lot about their childhood, and that is interesting because if then there comes a big shock like the pandemic, we see how much that depends actually on very early life circumstances. We also have blood, but that is today not so important. Okay, SHARE is a part of a global network which goes from the US. Here you see that in blue. If you go to the right, then you see Korea, Japan, China, India, Indonesia, South Africa. We now just start one in Egypt, Mexico and Brazil. So it's really a large network. And you see that there are countries involved which are not the classical European Western countries. But I have very little to say today about these. Okay, what do we do? We collect all kinds of data, health data, socioeconomic data, social participation data. I don't want to go into detail here. Just to take a mouthful, we call this a transdisciplinary observatory of human life. That's really bragging, but it shows you that the idea is a holistic view of what happens to people over their lives. That's why these life histories are so important. I'm an economist, but we devote about 40%, I would say, of the survey to health issues, up to the point that we know better than the respondents whether they, for example, have diabetes, because we have blood markers of diabetes. And all kinds, you can read it, all kinds of biomarkers, very modern biomarkers, for example, indicating cognition and cognitive decline. The important point is very international comparative. Everybody gets the same questions. And it's longitudinal, as I have pointed out before. And that a little bit reflects the study design, which we have also to study the effects of the pandemic. So the idea is we start with a parental and childhood environment. Lots actually happens in the very first couple of years. And then we have trajectories of health, family environment, work, economic conditions over the entire life. And the point is they interact. They strongly interact. Your health depends what happens in your work life, and your work life depends on your health. And also the social environment you're in both affects health and economic conditions. So these interactions are very important. Now, public policy tries to intervene here. And that is why it's so interesting to have comparative data here for different countries, because policy interacts differently in various countries. Even within the EU, we have really a large variety of healthcare interventions, health policies, social, economic, and labor market policies, and we use that to understand better the health, if I go to the right, the health, social, and economic situation later in life. So that's I call this sometimes study philosophy, of the share study. Now, with the pandemic, this gets super interesting because we know the different. If you look on the slide, right upper hand, we know that the countries are very different in terms of the severity of the pandemic. It has hit some countries much more than others. And the countries reacted very different. The stringency of the lockdowns were from lenient in some to extremely strict in others, and still are. So we have a lot of variation in policies, so with offsetting, if you go to the bottom, to the right, so the offsetting economic and social policies to alleviate the consequences of the pandemic and the lockdown measures. So we that is the background against where we do our analysis of the pandemic. Actually, we're lucky because with the share data, number one here is the life course background. We have that. We can always use it. Very helpful. It's a stock of knowledge, so to speak. And we had a wave just when the normal share wave, just when the pandemic started. Actually, we had to interrupt that because we couldn't do face-to-face interviews anymore. So we had to stop the wave. Unfortunately, we got already 70% of the sample in. So we were actually doing quite fine in most of the countries. Then we decided very, very quickly. In March, everything happened. We gave up, I have to say. And in June, we were already ready to have a new survey, actually done by telephone, which was the first specially designed Corona or COVID telephone survey. A year later, we did another one because we wanted to see not only the very first reaction, but also the long-term reaction. And now we're still in the field of a normal wave, which we do again face-to-face. We have started in November, by now, actually, this is not updated. We now have about 65% of the sample in. The people actually like being interviewed right now. They also were really appreciative that we called them in the time of pandemic. We were surprised by the high response rate. Where we fail right now is to recruit new respondents, younger respondents. And you will see that this reflects a little bit that the older generation, that's an important finding which I will show you, for them, COVID was easier than for the young generation. There are many reasons why this is the case, but I'll show you some figures in a minute. Okay, I don't have to go into this, just very, very quickly. The variation of the severity of the pandemic is quite striking, even in neighboring countries in Europe. And that is important when we try to identify effects. So from a econometric point, statistical point, this variation across the European countries helps us a lot. Again, that's a busy slide. We asked people about their health behavior, how careful they were, whether they were wearing face masks. Of course, we asked about their health status. And an important set of questions was about quality of health care during the pandemic. And I'll show you slides that this was worrisome in many countries. And of course, we looked at work, unemployment, layoffs, reduced working hours, but also early retirement and close of businesses. Of course, income losses, I already mentioned that earlier. And then the social networks, how help actually worked out, who was left alone in the pandemic, and who was helped by friends and relatives. Okay, so this is about the background of the share data. Actually, not a bad point if you have immediate questions about share. Well, we can also postpone it till later. Then I'll go ahead with the results. So you have already seen that slide. First results on income, labor market health, and a little bit on care and help within the family. So I start with household income, and I actually thought that this slide already is fairly shocking. You see the share of households with an income loss of more than 10%, and in some countries, if you look to the, I always confuse right and left. To the left, they're doing fairly fine. But on the right-hand side, and if you have good eyes, you see that these are the Italian countries, Hungary, Bulgaria, the Central European countries. This share is more than 30%. I find that a shocking number. If a third of the population has these kind of income losses. Now, even more shocking is if you go a little bit deeper, and this is a challenge. I can't see anything. So I have to explain what this is. This is a regression on income and education. And the dependent variable is suffering from an income loss. And it has a very strong education gradient and a very strong income gradient. So the people who anyway were poor and less educated suffered more income losses than the rich and the educated, in spite of all the countermeasures which the various governments have taken in place. And lots of these measures which governments have installed were actually progressive in the sense that they helped the poor more than the rich. But it wasn't enough. So definitely the first important result is very, very solid evidence that the pandemic has worsened the income inequality. By the way, the same also is if you look at the average household income loss, given that you had one, more than 10%, then obviously the numbers are relatively large. But again, it's surprising that you have so many countries with an average household income loss of 30% or more. Okay, you find the same kind of gradient. I don't want to dwell on that anymore. An interesting question is, why did these income losses happen? And there are two hypotheses. One is it happened because consumption declined, because people didn't want to go out of their houses. They didn't go shopping anymore. The entire economic activity went down because people were afraid of getting infected at the workplace or at the shopping places. That's hypothesis number one. Hypothesis number two, it was self-inflicted due to the lockdown measures. And that is not easy to find, to distinguish these two effects if you look at only one country. But if you have many countries which have different severities of the pandemic and different lockdown measures, then you can actually identify the two causes and you can separate them. That is why comparable data is so important here. And you see the scatter diagram. And what I wrote, you see slightly negative, but it's insignificant. You see on the horizontal axis the reported cases, the severity of the pandemic, and you see on the vertical axis, on the one hand side, the share of households with income losses, and the average household, the average loss, and you find the same finding. It did not really depend on the number of cases. So the first hypothesis that it was due to the severity of the pandemic, people were afraid, they didn't do shopping and so forth, is not really convincing. The opposite case is if you look at the stringency of the lockdown measures. So it's the same kind of slide in the vertical axis, but on the horizontal axis now is day with a particular stringent measure. We use the Oxford Stringency Index here, and here we find a strong positive and significant correlation. So these measures, don't misunderstand me. This is not a normative assessment. I'm just stating that these measures had large economic costs. Whether they're worth it, these large economic costs or not, that's a different question. But the economic losses were large, and they had an effect not only on GDP, but also a effect particularly on the people who are more exposed to the danger of income losses, and these were the people at the lower part of the income distribution. Okay, next slide is, and next topic is about job losses. And again, I want to stress to be careful what these graphs mean. It's the share of respondents who reported a job loss, and the job loss could be unemployment, could be a layoff, but could also be early retirement. And we don't distinguish in this slide, but you may be surprised if you look at the countries. Now it starts with the Netherlands on the left hand and goes to France on the right hand. In France, this is not unemployment, but it's early retirement. You saw a real wave of early retirement in France and creating a job loss. Now think about, these are 50 plus people. So for France, this is close to retirement age, I have to say, sorrow, and in Greece as well. So a lot of, quote unquote, unemployment was prevented by sending the people into early retirement. Whether that's a good policy or a bad policy, we don't want to discuss now. But you see the numbers are large. Whereas in other countries, Netherlands, Poland, Latvia, Denmark, Hungary, Czech Republic, Sweden, they were relatively low. This reflects the different policies, and we'll actually take a closer look at the policies where you really try to avoid job losses in a minute. Okay. Yeah, one other effect of the pandemic was that people didn't lose their job altogether, but their employer just employed them for shorter work hours. And again, the prevalence is fairly large. It's a busy graph. If you look at the blue dashed line, then you see it's about 23% of all people in our EU countries faced shorter work hours. Actually, quite a few also faced longer work hours. And you may remember that, particularly in the retail sector, there were more people hired, and particularly, of course, in the healthcare sector. Now, this is in the first panel survey. A year later, these numbers were much lower. The blue numbers are in 2020. The orange number a year ago in 2021. And you see that these short working hour situations decreased in almost all countries to about half or a third of it. Now, I actually was quite interested to dig deeper here, and I want to spend some more time on that in really understanding what happened here, and whether the policies which were enacted in the OECD countries worked. Because I think this is a policy instrument which so far has been somewhat underrated, although they have become a little bit more widespread. In 2008, I think Germany was the country who used that instrument very, very, very strongly. It's called short-time employment aid. So essentially, the employer hires you only for 50% of the time, or even less, and the government is paying for the remainder. So it actually is a huge program. Has been a huge program in Germany, very expensive, huge wage subsidy, but it has prevented high unemployment rates in the 2008 plus financial crisis. And unemployment in Germany was very low, very different from the United States, where you had a huge spike in unemployment. But Germany also recovered slower after that, whereas the United States had a very quick recovery. So the question is, do we see similar kind of effects now in the pandemic crisis, where many more countries actually used these kind of policy instruments? They were strongly pushed by the OECD, and that's also why I want to put a little bit more focus on these remedial policies. They have all kinds of names: job retention schemes, or short-time work programs, or wage subsidy programs. Anyway, the key is that employees keep their labor contracts. They do not throw out people, even if their entire work is suspended. But the difference in actual productivity and what the employees get paid is made up by the government. There are various kinds of them. I don't want to go into this table here, which is by the OECD, where you see all the countries in sort of different shades of these programs during the pandemic. My question is, did these remedial policies work? Did they work by targeting the right people? Actually, doing this, I first look at who actually was affected by shorter work hours, and you will see this was unequally. Did this particularly help the vulnerable people? And was the support sufficient? Did it really help these people? Because there was not always 100% set off. And then the typically question for economists, did they have side effects? And did they, for example, let shaky companies live longer, even though they had very low productivity and they better had closed? But so artificially were kept alive. There was at least in Germany, you used the word voodoo companies, which would do nothing. So these are the questions, and they're not that easy actually to study, as you would see. So the first thing is to look who was affected by short-term work. If you look, take a quick look at that table, I marked it orange. It was more than proportionally female, self-employed, low-educated, people with an unemployment history already, which we know from the data, and in the lower income tercile. So it's a classical combination of more vulnerable people. They were more affected by short-time work imposed on them by the pandemic. That's number one. Number two is, who actually receives short-time employment aid, all these kind of job retention programs. And now, for those who love statistics, look at the t-tests, it's not that easy actually to find significant results here. But if you look in the direction, then you see that it targeted correctly to the self-employed, also for the low income, but then also, and not to the high income, if you go to the very bottom, but then also some targeting failed, like female, where it's negative, or ever unemployed, where it's also negative. And for education, we don't nothing. No? So it's weak evidence that targeting was okay, but at least what you can say, it didn't fail completely, the targeting. There's no evidence that targeting went the other way around. There was some discussion, particularly in Germany, my own country, that it helps the middle class the most. That is not what we find. And if at all, then it does help the less advantaged people. But I would have liked stronger, statistically stronger results. The next question is, was it sufficient? Now that is a really difficult question because you need the counterfactual. And we don't have the counterfactual. We don't know what had happened if these subsidies didn't take place. So again, it's very weak evidence. What we see, however, is those who received short-time employment aid, abbreviated STEA. That's the yes column in the middle. 30% said we make ends meet fairly easily, and another about a third says even easily. So if you add those, 57.5% said it was okay. So again, it's the kind of evidence where you say, well, there is no evidence that it failed. But of course, you would have liked to see stronger evidence. If you look at those who did not receive any kind of aid, the sum is 76%. But that's no surprise that they get a higher because they are anyway better off. So again, I would say the sum is these measures have worked. The final question is about side effects. So we looked at unemployment rates a year until between a year and 1.5 years later. Do we see elevated unemployment rates among those people who have received short-time employment aid? And if you do it sort of the naive way, you look at the people who received this aid, that's the second row, and compare them did not receive aid, then you see that those who received aid had a higher chance of becoming unemployed. Okay? But that is very bad evidence because from the very beginning you know that the people who actually receive are selected. They are not a random sample of the population. They are anyway more likely to be in a weak position. So you have to do more statistics and more sophisticated statistics to actually understand whether that's a true causal effect. So essentially what you need is to have a sample where those who received this aid are the same as those who did not receive the aid. That's always the challenge in doing policy evaluation, and it's a serious statistical challenge. So we did this using 3 different methods. One is what you usually do. You take as many variables as you have and you condition on these variables and you hope that these variables actually describe the selection process. Then the people are, after conditioning, more or less the same. And indeed, you again find a positive effect. So higher unemployment. Now another method to actually do so is you match people. You go and really person by person, well, the computer does it for you, try to find people who are similar. If you do this, the results are almost identical. Again, you see that there are long-run effects. Another trick is to use first differences because then, well, at least so goes the theory, then you cancel out the selectivity effects, and again, you find a strong effect. So my conclusion from that is, and they're all significant. The middle one weakly so, but the other one are significant. So there is some, in German you say vermouth. You know what vermouth is? Absinthe in French. If you put that in the wine, it tastes sour. So they're as much as it may have helped in the short run, there are also serious long-run effects of these short-time employment aid policies during the pandemic. Okay, I think we're doing fine in time. So I have a little bit more time to talk about health. 5 more minutes, right? Yeah, good. So what happened? Looking at health. The first is, let's look at health behaviors. Actually, you see a comparison between the winter of 2019, 2020, and then the spring. And you see that social contacts severely went down. That's obvious what the governments wanted. That was a prudent health policy. You see it was quite different. Those who have very good eyes see that Sweden, which is number 2, there is almost no change, whereas Italy, which is number 5 on that graph, I wish there were a pointer. Actually, there it really went down quite a bit, so you have all these differences. We looked a little bit deeper and how social distancing and all these behavioral measures correlated with risk factors which people had, which are known to make COVID stronger as an illness, actually surprisingly, we find very little correlation, and particularly not in social distancing and wearing masks and these kind of regulated behaviors. So that was a disappointing result, and it's an interesting result insofar as obviously obeying, complying with these measures has to do with other things than your own assessment of your own risk in terms of health. An astounding finding was that if you look at mental health outcomes, now I'm going from health behaviors to health outcomes, this on the horizontal axis is a measure of, well, a broad measure of depression. Or let's call it sadness or blues. It's not clinical depression, but it's a broad measure of depression. And we compared the winter of 2019 with the spring of 2020, and you see it went down. Now, if you look, actually, we only have people 50 plus. If you look at similar surveys for the people 18 to 50, it's the opposite. It actually went strongly up. And it went stronger up for those between, say, 18 and 30 than those between 30 and 50. There's a strong age gradient in depression. Now you can speculate why not, and one effect which we can actually show in our data is there was more contact between parents and children, and that was obviously appreciated by the older people. And contact is very important for depression, sadness, loneliness, and these factors of mental health. If you find mental health problems during the pandemic, it is concentrated among women. Again, it's a busy graph, and more so in the south than in the north of Europe. But there was definitely a strong difference in gender between men and women. Now, by the way, we tried the same kind of analysis here, just show you, for all kinds of measures. I show you here for mental health, because I think this was particularly pronounced interesting during the pandemic. The same exercises you've been before. So on the horizontal axis are either the severity of the pandemic or the lockdown measures, and on the vertical axis, an index for health problems. Actually, to the left, it's the mental health problems. On the right, it's general health index. And what you see both effects, very similar, are positive and significant. So both the lockdown created health problems. You have to think a moment about it. As well as the pandemic itself. Now, why did the lockdowns create health problems? It should actually do the opposite. That was the purpose of the lockdowns. No, not in general. And that is the next slide. That's a difficult slide to understand. It shows you on the left-hand, well, the outcome variable is whether you have been deprived or forwent health care. And it has 3 dimensions. One is on the left-hand side is foregone because of fear of COVID. So people did not go to the hospital or to their doctor because they were afraid to get infected in the waiting room, or by the doctor, whatever. The middle one is that the doctor says, let's do this after the pandemic. So there was a lot of healthcare postponed, including routine checkups for example, cancer. And then the third one to the very right is that care was just simply not available because the waiting lines were so long, or facilities were closed, or couldn't be reached. So these are the three lines. Then the lines are marked in colors. You have to look closely. You see red at the top and green at the bottom. Red are those people who are in poor health. Green are those people who are in good health, and orange in between. And then as the third dimension comes in economic vulnerability. And this measures the log odds of not getting help, medical help, by economic vulnerability. And economic vulnerability is the usual question: can you make ends meet, yes or no? And we distinguish people very simple by that index. And what you find is that both health and economic vulnerability made it more likely that you forwent health care. And it's not only health per se or economic vulnerability per se, but there's actually an interaction effect between the two. So it's not only income, which already increases health inequality, has increased health inequalities during the pandemic, but also health per se and economic vulnerability in this interaction. And it's again the poor and the unhealthy who have suffered the most. And I think there is an important sort of research agenda, but also a policy agenda to be more careful about health inequalities, and not only always look on income inequalities. Health inequalities are really serious, and they have been made worse by the pandemic. Okay, I think I simply stop here. Just summarize our findings. More than 20% lost their job, faced income losses. It was a serious crisis, no doubt about it. Quite a few people worked fewer hours, and the remedial actions worked kind of okay. There is some evidence for negative long-run side effects. Healthcare crowd out. I actually think that's an important word to keep in your mind. Healthcare crowd out, because people were crowded out of the healthcare system due to the pandemic. Actually has had effects on the so-called social gradient, socioeconomic gradient of health. It has made health inequality worse. And so there's quite some action to be done in improving both our economic and labor market policies, but also health policies to be better prepared for, I hate to say this, for the next pandemic, but we do know that pandemics come in regular intervals. Large variation by country, and again, very typical for all EU kind of analysis. Things worked out a little bit better in the north than in the south. Okay, thanks for your attention. And thanks for having me here.
So thank you very much for a great talk.